A 16-year-old Native American girl named Joanna Birdsong presented to the Indian Health Facility, or the IHS, with her 2-year-old son, Joseph, and her parents. She's concerned about how her son has been acting lately. He's been fussy and crying a lot. She expresses her concern to the nurse that young Joseph probably has an ear infection. She mentions that she tried smudging, a common Native American practice of burning sage to heal diseases. She mentions that her parents are insistent on only using traditional holistic tribal practices to heal her son. The parents are in the waiting room with the daughter and the child. Joseph is observed crying periodically throughout the assessment, is unable to sit still, and is visibly in distress. His cheeks are red, his clothes and diaper are visibly soiled. The nurse notices that Joseph is not exhibiting any nonverbal cues that he has an ear infection, such as pulling at his ear. The nurse takes the vitals, and they are as follows: blood pressure 112/70, pulse 130, temperature 100.1 degrees Fahrenheit, respirations 30, O2 99 on room air. The nurse realizes that these are normal vital signs for that of a 2-year-old and are different than that of an adult.
The nurse uses the Flack scale to assess his pain score. The nurse notes that he has a slight temperature. She attempts to look in his ears with the otoscope, but the child is not cooperating. He is crying loudly and thrashing his body to avoid the nurse's touch. Joseph's mother quickly grabs a bottle from her bag and hands it to her son. Immediately, the nurse is alarmed because in the bottle is not milk, but what appears to be soda. The nurse looks at Joanna and questions what is in the bottle that he is drinking. Joanna answers that it's Dr. Pepper and that is the only thing that he will drink to calm down. The nurse asks how long she has been giving Joseph soda in a bottle, and Joanna answers that she is not sure, but he wasn't one yet when it started. The nurse asks how and when she brushes Joseph's teeth. Joanna responds that she doesn't brush Joseph's teeth because he doesn't like it and he screams, so she chooses not to do it. The nurse asks Joseph to open his mouth and he shook his head no with the bottle still in his hand. Using her nursing knowledge of children and their behaviors, she then asks Joseph to pretend like he is a lion and roar as loud as he can. Joseph's face lights up with excitement as he opens his mouth as wide as he can and lets out a loud roar. The split second that his mouth is open, the nurse is able to assess heavy tooth decay, a foul odor, blackened gum line, and drainage from the back of his mouth. The nurse immediately excused herself from the room and calls the dental practice in the same building, asking if there's someone available for a consult. The nurse re-enters the room and notifies the family that she has contacted dental services and she has concerns about his mouth and would like to have an interdisciplinary conference with the family. Joanna's father states that they do not have dental insurance and that there was no need to talk to a dentist. The nurse informs him that IHS will be able to cover the family with both medical and dental insurance, and the family agrees to the meeting. The nurse then educates Joanna about the use of a bottle after 12 months of age and improper use of soda in the bottle. The nurse explains to the family that she is concerned about Joseph's oral health and the amount of pain that he is in. She discusses the importance of oral health in relation to Joseph's pain and overall health. The family agrees to see the dentist, and Joseph receives dental work and a prescription for antibiotics. Joanna thanks the nurse for helping her family and her son and states that she will try harder to have him brush his teeth. She also remarks, however, that she will still be trying traditional practices before seeking Western medicine help, as it is important to her parents and her culture.